So I think it goes without saying that the use of the abutment is only indicated if the implants are stable. If you don't have stable implants, then a delayed loading protocol is preferred, where the patient or you might place the implants, cover screw, put the tissue over the implants, have the patient wear a conventional denture, and then after a period of healing time, generally 3 to 6 months, you come in second stage the implants, and now you can use the abutments to proceed with loading the implants with a provisional and then going on to the definitive restoration. So the material that we're showing you here is the assumption that the implants have enough stability to be loaded day of surgery or after a healing period.